Having come from what was, I suppose, a semi-private system in Ireland, where a lot of people, 2/3 of the population paid for their health care through voluntary health insurance scheme, I was amazed when I came to the NHS about the comprehensive nature of the care that people could receive, and how even the standard of care seemed to be around the country, generally speaking, and how well run the NHS was for such a big organisation to be providing the level of care that we're providing, and for it to be free. To me, I was quite impressed with this, very impressed, definitely. And subsequently, having worked in other countries where there's a sort of part private health system, particularly Australia, New Zealand, Canada, I found that my opinion of the NHS hasn't changed in all that time, which is that I think, given the proper funding, it is an excellent healthcare system, which is, I think, by far and away the best one that I have worked in. The introduction of the internal market was not a good thing. GPs were given a pot of money, and secondary care hospital trusts were given another pot of money, a different pot of money, and basically we had to trade with each other in order to get health care for our patients. Once you introduce separate budgets, people started to defend their budgets, and that led to tensions. One of the advantages of having a universal healthcare system that's free at the point of delivery is that actually there is no incentive for doctors to try and use the system to I suppose, improve their wealth. That they are the main driver for them is really to look after the healthcare of the population. General practice or primary care only gets 7% of the NHS budget, and yet it has by far and away the greatest patient contact. Seeing 48 patients a day was nothing. And now if you think of trying to just meet 48 people in a day and just say hello and just establish very quickly any sort of relationship with 48 people, that's quite a difficult thing to expect a human being to do. To then expect them not only to do that, but to actually try and assess a physical or mental health problem that they have at the same time is really quite difficult. People forget then there's all the results to go through, the letters to go through, the phone calls to make. What happens if an emergency occurs while you're in the middle of all this? And over 30 years I noticed a big change from having time to do things and having time to properly assess patients, and even having time to have lunch to a point where really there was no time, that you're just rushing from one thing to another. I think the stats show now that 40% of GPs report being depressed at some stage due to their workload. Most failures are actually system failures and not individual mistakes, and most people die because of system failures rather than individual mistakes. And yet the GMC, rather than supporting doctors, which they claim to do, have actually very deliberately gone and tried to scapegoat doctors for things that have happened. The heads of the GMC are generally government appointees, and seem to have very much sided with government policy and not listened very much to what doctors have been telling them for years. There are many others who've actually lost their jobs, lost their livelihood, because they have tried to report problems within the NHS. Demoralisation is, I think, huge throughout the NHS at the moment, and not just among doctors. I think most GPs will tell you what we predicted would happen, and what we were afraid would happen has come to pass, that waiting times have got longer. There is now more restriction on the sort of procedures that we're allowed to refer patients for. That local community care, which was supposed to take over from secondary care, with more people being treated locally in their home, in the community, this has not this hasn't worked, and it hasn't worked because there isn't the funding and there isn't the staffing to make it work. And I think most GPs I speak to seem to feel that that's the way it is, that everything has been stacked against them, and given the fact that the government have known about the pressures on general practice for the last, 10 or 15 years, all the steps, they've not taken any steps to reduce that workload or pressure. Indeed, all the policies they've enacted seem to be driven in the opposite direction. They seem to be designed really to increase GPs' workload, to almost force them out.